In this video, I'm going to discuss LASIK surgery. LASIK is also known as the flap and zap procedure, is one of the most common elective surgeries performed in the world. Well over 16 million procedures have been performed since 1991, with an extremely high satisfaction rate, well over 95%. LASIK involves opening a flap in the cornea, which is the clear window in the front of the eye, and then using an excimer laser, which is a cool ultraviolet light laser, to reshape the eye, much like sculpting a contact onto the eye. LASIK surgery is elective and is performed to decrease or eliminate dependence on glasses and contact lenses. While we won't guarantee you 20/20, I will certainly do my best to get you the best vision your eye is capable of. LASIK works best for patients with low to moderate degrees of nearsightedness, farsightedness, and astigmatism. I typically do surgery on both eyes in the same day. You'll be in the operating room for approximately 10 minutes, and it takes about 3 minutes per eye for LASIK. I do the treatment under eye drop anesthesia, meaning no needles, and we usually give you a relaxing medication by mouth, typically Xanax. During the treatment, you'll experience a mild pressure sensation, but no pain. To create the flap, the newest, most sophisticated laser, called the Xemer laser, has replaced the older INTRALASE laser that most surgeons use to create the flap. The Xemer allows for the only true all-laser flap and uses 1/10 of the energy of the INTRALASE, resulting in much less inflammation under the flap and faster recovery of vision. With the INTRALASE, the very large high-energy spots don't all connect and actually require a dull blade to open the flap. With the Xemer, there is no necessity to use a dull blade to open the flap, making it true all-laser LASIK. After we create the flap is then lifted, and then a cool excimer laser, which is an ultraviolet light laser, is used to sculpt tissue from the cornea to correct your vision. We then lay the flap back down. The flap sticks back in place through the natural corneal pump that acts like a vacuum. While you may have somewhat improved distance vision immediately after the surgery, the vision will be blurry, like you're looking through Vaseline or smoked glass. In addition, the eyes tend to burn, sting, and tear for the first 4 to 6 hours. I'll ask you to keep your eyes closed for the first 4 hours after surgery to let the flap settle into place. Follow-up occurs the next day, then usually a week or 2 later with either us or your optometrist. We use drops for 4 days after the LASIK procedure, including an antibiotic and steroid drop. The risks with LASIK are low and typically very treatable. In fact, LASIK is much safer than contact lenses. You take twice the risk of losing your vision or losing your eye with a contact lens compared to LASIK. There are risks to LASIK. In my hands, infection occurs about 1 in 10,000 cases. I've done 20,000 LASIKs, I've seen 2 infections. Luckily, both infections were away from the center of vision, and actually one of the infections was created by the patient by rubbing the flap. In both cases, the patients did well with excellent vision recovery. That's not to say that you couldn't get an infection in the center part of the vision that could be very serious. I've just never seen that in my practice. The next potential risk that we need to talk about are flap-related complications. Things like an irregular flap, cells under the flap, inflammation under the flap. As a group, these tend to occur less than 1% of the time and are very treatable. These risks are less with the laser than they are with a blade when creating the flap. The next risk we need to talk about is enhancement or retreatment risk. If we get your vision close but not exactly where you want, we'll go back typically at 3 to 4 months, lift the flap, and place more treatment under the flap. And this is called an enhancement. The enhancement treatment is actually less risk than the original treatment because we have a good flap. Up to about 3 to 4 years, we can lift the previous flap. But beyond 3 to 4 years, we need to brush away the surface cells and do the retreatment on the surface of the eye. The last time I published data on enhancements, approximately 5.6% of the eyes that I performed LASIK on for nearsightedness required a retreatment. The higher your prescription, the more likely you are to need a retreatment. The last and most serious risk that we need to talk about with LASIK is something called ectasia. Ectasia is a progressive steepening and thinning of the cornea that requires a hard contact lens, a plastic insert called an intact, or a cornea transplant to fix. The good news is that ectasia is extremely rare, only occurring approximately 1 in 20,000 patients. The risk factors for developing ectasia include a prescription more than -8, an unusual shape to the corneal map, or thin corneas. And in these circumstances, we tend not to perform LASIK. Side effects with LASIK can occur, but these typically improve or disappear with time. However, in rare circumstances, these side effects can be permanent. The first side effect I want to talk about with LASIK is dry eye. Patients who experience dry eye will have burning, stinging, and blur, particularly at the end of the day. Dry eye symptoms after LASIK are most common in patients who already have dry eye prior to surgery. It's also more common in women, those over age 40, and patients with thyroid or autoimmune disease. The reason that LASIK can create a dry eye situation is that in making the corneal flap, the nerves are disrupted when the flap is created. As a result, the brain doesn't know that the eye is dry and fewer tears are created. The next side effect that I'd like to talk about is glare and halo that typically happens at nighttime or in low light conditions, where you might see a glow around lights or glare coming from oncoming traffic lights. The three risk factors for developing glare and halo are: number one, do you currently have it in your glasses or contact lenses? If you do, you're more likely to have glare and halo. High prescriptions are more likely to have it, and patients that have large pupils. Of late, there's some more recent data that implies that large pupils may not increase the risk of glare and halo, but traditional thinking is the bigger the pupil, the more likely you are to see this particular side effect. The last side effect that I'd like to describe is something called loss of contrast. Luckily, this is something that is typically not noticed by most patients. However, it can be seen as when you walk into a dim room or in fluorescent lighting, things just seem a little hazy compared to your vision with your best pair of glasses or contact lenses. The main risk factor for developing loss of contrast is having a high prescription prior to surgery. In patients who are nearsighted or myopic, LASIK tends to be a little bit more accurate with fewer side effects than in LASIK for patients with farsightedness. Patients who have farsighted LASIK are more likely to have side effects like loss of contrast, glare and halo, and are more likely to need early or late enhancement because the treatment tends to heal back with time. For patients who are farsighted, the eye is too short. In farsighted LASIK, we have to steepen or create a little bump in the cornea to improve the vision. As a result, the alteration of the corneal surface and the bump that's created is more likely to heal back. We also perform LASIK for patients who have astigmatism. Astigmatism is when the eye is more curved in one direction and flatter in the other. Patients with a higher degree of astigmatism, over 2 diopters, which is a measure of the power of the lens that's used to treat astigmatism. Patients with a high degree of astigmatism are at higher risk for glare and halo, they're at higher risk for needing a retreatment, and they're at higher risk for losing what's called best corrected vision. After surgery, if we don't get you to 20/20 without glasses, typically a thin pair of glasses will get you back to 20/20. If it doesn't, that's called loss of best corrected vision. A mild loss of best corrected vision is often not noticed by the patient. Even though you may have had LASIK, there's still a need for regular eye exams. Nearsighted patients in particular have a lifetime increased risk of glaucoma and retinal detachment. I would like to talk to you a little bit about my experience with LASIK surgery. I was one of the first ophthalmologists in the United States to have LASIK on my own eyes back in January of 1997. I was nearsighted my entire life. I wore glasses and contact lenses and essentially couldn't function without them. I was very active outdoors. I played golf and tennis and swam, and glasses and contact lenses really interfered with my ability to do those outdoor activities. When I had my LASIK surgery, it was not yet approved by the FDA, and I actually went outside of the US in order to have my eyes done. My experience was great. It's one of the best things I've ever done for myself. My surgery was quick, it was painless, and 4 hours after the procedure, I was seeing. My LASIK surgery is now 15 years out, and my distance vision is still excellent. About 2 years ago, I noticed that my reading vision started to diminish. I went back to my surgeon and had the laser vision correction repeated to give myself some up-close vision or monovision. In summary, LASIK is one of the most common surgeries done in the world and has an extremely high rate of satisfaction, including in my own eyes. While I can't guarantee perfect 20/20 vision, statistics show that the majority of patients get 20/20 vision, and the guarantee I can make you is I'll take the best care of you I know how.